Hi, my name is Kelly Pruitt, and I'm in the RN to BSN program at Bluefield State College. Today we're going to be discussing my senior change project, which was promotion of oral health in long-term health care. The goal of my project was to promote oral health in long-term health care. My objective was to create mouth care guidelines at Pine Lodge by developing and presenting a 15-minute presentation by October 26 of 2018. A handout with staff and patient education would be provided so that the program's change could be continued. Appropriate oral care tools would be provided to all patients upon admission and at discharge. I chose oral care as my project because I feel that oral care does not get provided to the residents in our facility. According to Lee and Sommerman 2018, a 2011 to 2012 survey of the Center for Disease Control, CDC's National Health and Nutrition Examination identified dental caries in 91% of the adult U.S. population. Research has also shown that poor oral health leads to other health concerns such as diabetes, heart disease, pneumonia, and malnutrition. So I felt that this was very important to address poor oral health in our facility so that these things could be prevented for our patients. Some of the restraining forces that I came across during this project was lack of resources. During the beginning, I had a hard time getting the appropriate oral care tools, such as better toothbrushes. That was one of the things that they requested we get for the facility because residents were complaining that during oral care the bristles were hard and falling out in their mouths. They were getting choked. So that was one of my main goals during the beginning of the project, was to get better toothbrushes. Dental floss was also not available in our facility, and I've been here for 8 years and had never seen dental floss, and we have a lot of younger residents coming into our facility for rehab, so I felt that it was important to have the necessary tools so that oral care could be performed. Another restraining factor was time. I didn't have a lot of time to pull all of this together, so that made it very stressful at times, but overall I feel that the project did get done the way that I wanted it to, and I'm very happy for the changes that have been made so far. Another restraining force was resistance to change. I know that management and even the Genesis corporate are resistant to change, especially whenever it's coming from somebody at a lower aspect of the nursing staff. So that was a big restraining force. And then staff turnover. We had a lot of staff leave our facility during the time of the project. In the beginning, we had a lot of new staff, and so that was a big restraining force for me. And then agency policy. As I said, we're a Genesis facility, and policy goes across the board for all Genesis facilities, and to get things changed in the policy just for our facility was very, very challenging. Some of the driving forces were that staff were open to change. Whenever I brought this project to everyone's attention, they were like, this is great. They felt that oral care was lacking in the facility, and they were all kind of on board to get this change rolling. And then another driving force was the need for change acknowledged. A lot of people acknowledged that the change was happening in the facility, and it promoted more confidence in me during this project, and it was very exciting to know that everyone was starting to get on board and acknowledging the changes that were happening. And then support from the nurse educator and central supply team was huge for me because I collaborated with these two team members to get better oral care supplies and have the nurse practice educator as my mentor throughout this project. This is a picture of Pine Lodge. We are a 120-bed facility. It's located in Beckley, West Virginia. We have private and semi-private rooms. As you can see, it's a very nice facility. So whenever I started the project, I had a questionnaire with some of the following questions. I had 10 employees fill out these questions and turn them back in to me. And one of the questions was, do you feel that oral care is being performed daily in the facility on all patients? And 10 out of 10 said no. And that was pretty big amount, significant amount for me to get this change started. Another question was, have you read or heard about the importance of daily oral care to promote overall health? 9 out of 10 said yes. I was very impressed by that. And then another question was, would you be willing to serve on a committee to help with this project? 8 out of 10 said yes, that they would be on my committee. However, I only ended up with 3, including myself, so 4 total. And then throughout the project, I lost one of my committee members. They were no longer employed in the facility, which was unfortunate, and I reached out to them to see if they still wanted to meet during the committee meetings, and they never responded. This was the committee group in the beginning, and as I said, we did lose one. All of these are nurses and fellow employees. So the action plan, of course, was to promote oral health and have a healthy mouth, have healthy smile, and prevent some of those diseases that we mentioned before. I also wanted to make sure that during admissions we were collaborating with like dental healthcare teams to make sure that we were getting our new admissions scheduled for dental procedures, and during the initial assessment of the oral cavity that we were checking for any sores in the mouth, poor fitting dentures, to make sure that those weren't things that were causing the patients to become malnourished related to pain and them not wanting to eat or have oral care performed. So it's very important upon admission that we were making sure we were assessing the oral cavity and collaborating with dentists if we needed to get dentures resized or any changes made to their health, that health care they were getting provided. And then another action plan was, of course, my guidelines to follow for everyone in the facility to kind of have a generalized idea of what guidelines we needed to be abiding by according to Genesis policy, and then things required in our actual facility. And then, like I said, another action plan was to get the appropriate oral care tools like dental floss and toothpaste and better toothbrushes. So I got soft bristle toothbrushes, which means that we no longer had the bristles falling out in the patient's mouths and them getting choked on them. So they have been more apt to let the healthcare team provide oral care on them. That's been a positive outcome of this project. I also got dental floss brought into the facility. And I didn't have to spend a lot of money on this project, which was excellent for not only me, but the facility. And then, of course, having the staff on board to provide the oral care. These are some of the guidelines. That was a handout that I gave everyone. And this is just something that we're going to go by to, if you ever have a question, any staff had a question about, what do I need to be doing? How often do I need to do oral care? These are things that they can go back to and follow. And one of the big ones was the NPO patients, them having oral care provided at least every 2 hours. This is huge for us because we are seeing more NPO residents, peg tubes and things like that, and that was a huge question by CNAs. They're asking, what can we do to help increase the oral care, and that's that we need to be doing this every 2 hours on these patients. And this is just a great thing, a great resource for them to fall back on and have in case they ever have any questions and there's not someone that can appropriately answer that for them. And this is not only for CNAs but also LPNs and the RNs in the facility, because we all are a healthcare team together and we can all perform oral care for our residents. My go live date was October 26, 2018. It was in this room here, and I had a very good turnout. I was very impressed. My in-services lasted 15 minutes, and I had 3 of them. I had one in the daytime, the evening time, and at night, so that everyone could come if they wanted to, and I had a pretty good turnout. Everyone was very attentive. They said they learned a lot. They gave feedback, positive feedback, and they said that they we were seeing changes made in the facility, which made me feel really good about this project. So these are some things that worked well, and then some things that didn't work well. Some of the things that worked well were that staff in the facility were able to collect items without having to spend much money on the oral care supplies. As I mentioned before, we didn't have to spend a lot of money on these items because they were things that were already in the budget, and I was very happy that we could get those and that I didn't have to go out and get people to donate those items for us. Another thing that worked well was that nursing staff liked using the new toothbrushes, and dental floss was made to them for patient care. This was huge for me because I started hearing people like, where did we get these new toothbrushes at? And they were talking about how they were using them, and it was a really, really good thing for our project that we got these items so that the staff was able to provide oral care for the patients. And then supportive mouth care guidelines. Upper management was really supportive with me coming up with these guidelines because, like I said, they're still following policy, and it's just easier for them to go back to or refer to. And then some of the things that didn't work well, I did have a hard time getting the committee members together for meetings because some of them live outside of Beckley, and sometimes we didn't work the same schedule, so it was a little difficult trying to get everyone together, but overall we did pretty good, and everyone showed up for the meetings. Another thing was that we had some difficulty making sure that oral care kits and tools were being provided on admission and at discharge. And I did assign certain people in the committee to make sure that this was getting done. For example, if I wasn't in the facility, to make sure it was getting done, that they were doing it whenever I wasn't here, or vice versa. And that's something that we're still trying to work on. And then I have SMILE because the goal is to promote good oral health and good oral health overall. And then again, my name's Kelly Pruitt. I'm a registered nurse, and my email is pruitt_km@live.bluefieldstate.edu. Thank you.